I am Peter Gatia from Amref Health Africa. In 2013, we partnered with the United Postcode Rotaries, Girls Not Brides, and Tostan to work towards ending the harmful practices of female genital cutting and child marriage in communities in East and West Africa. The United Nations reports that more than 140 million girls and women alive today have undergone some form of female genital cutting, and that 1 in every 3 girls is married before reaching the age of 18. These practices negatively affect the health, integrity, and security of girls all over the world. I am proud to report that over the past 2 years, working hand in hand with our partners, we have collaborated with dozens of communities in Kenya and Tanzania to implement alternative rites of passage projects that have directly resulted in more than 6,500 girls avoiding female genital cutting, and dozens of our partner communities have publicly declared that they will abandon the practice of child marriage. Together, we are working to improve the health, well-being, and dignity of girls and women around the world.
I'm Hanin Ode of the Royal Health Awareness Society in Jordan. By 2020, chronic diseases are projected to affect over 50 million people around the world, causing twice the deaths of infectious diseases. For that reason, and Jordan, of course, is no exception of that, according to the WHO report, 76% of all deaths were attributed to chronic diseases in 2014. That's why, in 2015, the Royal Health Awareness Society committed to scaling its Healthy Community program from 6 centers to 12 centers across Jordan. The program aims to help patients monitor their non-communicable disease, or NCDs, through promoting healthier lifestyles and health education. It builds the capacity of the Ministry of Health practitioners to offer better preventative and counseling services, and provides medical supplies to monitor patients with NCDs. We're excited to announce that with the support of our partners, BD and Direct Relief, whom we met through CGI, we have secured the expansion of our program to 4 new centers. These centers will address the growing need and burden of NCDs in Jordan in light of the Syrian refugee crisis, reaching up to 4,000 people, both vulnerable Jordanians and Syrian refugees in host communities. Thank you.
I am Jorn van der Meer from Heineken. In many African countries, there's a lack of access to agricultural resources and infrastructure. This prevents smallholder farmers to progress from subsistence to small-scale commercial farming. With 56 production plants in more than 20 African countries, Heineken relies on a secure supply of crops and raw materials, which we have to import if they are not locally available. This leads to increased cost and environmental impact. For this reason, Heineken committed in 2011 to locally source 60% of the raw materials used for our African beers by 2020. We provide farmers with seeds and chemicals, technical expertise, and purchasing guarantees. Today we are proud to report that we are on track to reach this goal, and close cooperation with the NGOs, local authorities, and the Dutch government has been key to our success. With 16 local sourcing initiatives in 11 African countries, we succeeded to shorten our supply chain and to contribute to the local economy in our African markets, empowering over 120,000 smallholder farmers in Africa. Thank you.